For me, I'm seeing patients a lot further down the line when they're back in general practice for their ongoing maintenance and care. And I think that's where I met a couple of patients that had gone through head and neck cancer treatment. It's where I became acutely aware of the discord between medicine and dentistry, meaning these people didn't have the provision that they really needed to keep them healthy. And we know that when these people suffer tooth decay and gum disease, it can affect their dentures, their prosthesis, their reconstruction. So then it can often mean that there's other things that happen later down the line that could have possibly been avoided had there been better and more efficient care in general dental practice. So some people that have gone through head and neck treatment and its associated therapies often find it difficult to open their mouth fully, and that's called trismus. And it might mean that they're struggling to get a regular toothbrush around the back of their teeth or any in other hard to reach areas. Obviously, it's really good to use dental floss or interdental brushes if someone is able, but the other thing I recommend is a single tufted brush. If it's got slightly longer bristles on it, it's called an interspace brush, but it's for mechanical plaque removal, which means that you're literally wiggling it around the gum line or any other bits and bobs in your mouth that need to be cleaned. A good top tip as well is to wet the whole thing before you start, and then if you've got a particularly dry mouth, when you slip it in down the side of your cheek, it doesn't get caught on any of the soft tissues, and you're then able to wiggle it around. You can put toothpaste on it, you can leave it dry, just have it wet with water or even a mouthwash, and another chemical adjunct that's maybe been advised by your dental professional. You can then wiggle it around those areas and get rid of all the plaque and prevent any gingivitis or tooth decay that might happen around that area. So for me, attending the Salivary Gland Cancer event today, it's been so inspiring to hear patient stories. There was a couple of times as we started going off around the room, everyone explaining what their link was to the event today, whether they're a patient, whether they're a clinician, whether they're a carer. There were so many times I felt like I was on the verge of emotions because it's so poignant to hear those stories, and it really makes you want to be a better person, to provide a better level of care. And it also makes you want to stand on the rooftop and shout about what people are going through, to raise money, to raise awareness, to raise education for clinicians, for other people going through it. I think that's really what I've taken away, is how we can all work better together, but also, that advocacy for the charity as well.